Hello and welcome to episode 12 of Strictly Healthy. And of course, this is the show that discusses all aspects of our health, whether it's physical, mental, emotional, general well-being we discuss, as well as business health and financial health. So anything really that impacts on our health, which is holistic. And we'll be talking more about holistic health today. I'm very excited that we have Dr. Rajendra Sharma. I hope that I've said it correctly. And he's an integrated medical doctor. He uses conventional, functional, and complementary medicine. So we want to welcome you today, Dr. Sharma. Thank you for sparing your time and joining us today. And I just need to mute you. Unmute yourself.
There we go. Can you hear me now?
I can hear you. Thank
Super.
you for joining us today, Dr. Sharma. So I've got a raft of questions, some submitted by other people ahead of time. But today I just wanted to talk about your practice a little bit. Now you work out of Exeter as well as London. So I just wanted to ask, first of all, how are things impacting the situation for you now with the current lockdown?
That's kind of you to ask. Thank you very much. And thank you very much for having me on. I've returned to the Hale Clinic, where I was the medical director for a few years, a couple of decades back. And I was the medical director there. I had a team of about 60 different integrated and holistic complementary alternative practitioners working with me. So I'm predominantly London-based with my work, but I do live and work in Exeter as well. So it's perhaps slightly the other way around from the way you put it. But
Right.
At the moment, the impact has been that I'm doing most of my consultations, of course, online, as are most doctors, unless there's a necessity to meet up with people. And because of the issues with lockdown and even tiers 3 and 4, I haven't been up in London very much, but still very, very active. I and my peer group and my colleagues are all very busy because we've got a lot of worried people. And the sort of people that come to see integrated doctors like myself, doctors, as you said, who specialize in complementary alternative and now what is called functional medicine, and yet have minimally a general practitioner's qualification. We're tending to be in demand because people are worried. They're not quite sure what a chronic disease is, whether they are at risk. There's a lot of questions about the virus, a lot of questions about the vaccination. So we seem to be as busy as we ever have been.
So yes, so can you explain just the difference between, or what is integrated? So you've got the functional, you've got the conventional, and not holistic, but naturopathic, yeah?
Yeah,
can you
anybody can be holistic. That's just a case of opening up your mind and thinking about things as a whole. Conventional doctors go through medical school, they go through their medical training and their speciality. And the main aspect of conventional medicine really is to try and help people feel better as quickly as possible. And there isn't that much research done into the underlying causes of disease in the same way that there might be in functional medicine. Functional medicine practitioners tend not to be taught the acute medicine and the use of drugs or medical procedures, but they are pretty much expert in understanding the physiology of the body. So they are quite good at looking at why something happens, what actually goes wrong to create the problem that the doctor might face. So an example would be, let's say, rheumatoid arthritis. Rheumatoid arthritis, as people will know, is an inflammation of the joints. And if those joints are inflamed, conventional doctors are remarkably well trained in the drugs that we've got out there, and they're ever improving, ranging from painkillers, steroid medication, and immune modifying drugs to help people feel better and come away from the pain. But there isn't an awful lot looked at as to why it's happening. Rheumatoid arthritis is an autoimmune condition, and the reasons why people get autoimmune problems is not much studied, mainly because there isn't a simple drug that takes care of it. So functional medicine practitioners tend to look more deeply and look at the main roots of illness, which include things like exercise, good and bad habits, nutrition, dietetics, psycho-spiritual well-being, to a degree our genes, and we can modify those through the science of genomics now. Many drugs are aimed at genes, and they are gene modifying. So anyway, an integrated doctor is somebody who's trained in both.
Okay, so you obviously are trained in both. So I find conventional medicine or practice seems to just sort of put a mask on things. And as you said, the integrated and what you practice tends to go deeper. Which do you sort of favor, and what do you find people are getting fed up with conventional processes?
Well, I think it would be fair to say that the people who see me may or may not be fed up, but what they are doing is they're looking for an approach that differs from that is offered by a conventionally trained doctor. In my case, if somebody comes in with a fulminating infection, I'm very likely to offer an antibiotic. The people I tend to see, though, are those who have recurrent infections, and that recurrent antibiotics are not actually resolving the problem. So I think people in my field tend to see chronic diseases and problems that aren't resolving. And that's really the difference between perhaps a functional medicine practitioner and a conventional one. And I suppose wearing both hats is where everybody should be. There shouldn't be differentiation. There should just be medicine, really, shouldn't there? There should be treatment approaches that take the best of both worlds. And perhaps, not necessarily in my lifetime, but perhaps that's the way we will go. And I think the COVID pandemic is actually pointing out a way there, because we're dealing with a lot of active treatments against COVID, when in fact we need to be having a look at prevention and predetermining how we need to be so that we don't fall into the risk categories of
Right.
COVID.
So since you've mentioned that then about COVID and prevention, what do you see as the sort of future with regard to COVID, or how can we go about preventing it? And what do you think of the vaccine and the situation there?
we don't have the day to discuss this. Okay, what do I think? Firstly, COVID-19 is the disease, and the virus that causes it is a SARS-CoV. It's called SARS-CoV-2, and it's a coronavirus. We have lived with coronaviruses, and sadly, we've died with coronaviruses, and they've been around since we were able to start recognizing coronavirus as opposed to adenoviruses or rhinoviruses and the many other different forms of viruses there are. What we're learning here is that this particular virus has got a virulence. It's got a capability of transmitting itself quite swiftly, more so than, let's say, the influenza virus. And we're seeing that the new strains may be even more contagious, not necessarily more dangerous, but more contagious.
Yeah.
The problem, therefore, and the question to ask is what's going to happen to us as a species as we face more and more potential viruses. We went through quite a few decades with very little in the way of dangerous pandemics. One could argue that the AIDS pandemic never quite panned out to be the risk and danger, and it seemed to be limited to those who took risks with their sexual activity or had blood transfusions. You can also look back then to the Spanish flu, and in between there were a couple of others that didn't quite get the popularity that the one we have today. But in the last 17 years or so, we've had SARS version 1, we've had MERS, and now we've got SARS CoV-2. We've had a couple of others, again, not all that popular, but we can include things like the avian flu and the swine flu. So that's 5 in the last 17 years. So what we're beginning to see here is that something is going on that is influencing the way that we are dealing with new and evolving viruses. I'm going to plug my book a little bit here. And just to say that in it, I've actually updated it recently and put in a section on novel viruses, which of course includes the coronavirus, but it's something that I think that we've all got to look at, because we aren't going to be able to beat nature. We very rarely do. We can contain
Mm,
it,
mm,
but we can't usually beat it. And at the moment, it seems to be throwing a range of different infections at us. We're also facing the risk of more and more resistant strains of bacteria because of our injudicious use of antibiotics. So I think
mm,
the human species is going to have to adapt, but it will do so anyway because we have to adapt to save the planet. And we can actually draw a lot of conclusions from the way that we are dealing with our planet and the way that we are mucking around, particularly with our soil, which is changing our environment, which is changing the way that animals behave. It's changing our interaction with animals. And these viruses may well stem from animals. So whether we're eating them and getting them from fish markets, whether they are emerging from experiments that are going on in laboratories, or whether we're just simply so close to what's left of the wild species, we are coming into contact with more and more viruses that we have to deal with now. We're not
mm.
keeping up with medications and treatments. So we have to be looking at being proactive and looking after ourselves.
Sure. So
And
let me expand a little bit on that. How you said about a sort of more natural solutions or something that addresses the core problem. Um, can you just speak about that? And
of course,
you mentioned also about the soil. I understand glyphosate plays a big part in causing a lot of problems for us in our health.
well, let's deal with that last part first, because that's a huge
Okay.
subject and it won't take up much time. Yes, if we do put pesticides on the soil, we lose our insects. We lose our insects, we lose our birds and our other rodents and animals. We lose a lot of fertile manure that goes in from these smaller insects. So any pesticide is going to create a problem. But pesticides do as they say, they kill pests. And a lot of our soil is
Yeah.
dependent upon the activity of bacterium in the soil, and they too are going to be killed off. Over farming is also creating a loss of minerals. So our plants
Mm.
aren't necessarily getting the nutrients that we think are in them. So that's the soil bit out of the way, but that's an ecological talk we could do another day.
Sure.
With regards to what we can do as human beings, well, if we look at how COVID behaved, it seems to attack those and create the cytokine storm, the actual dangerous part of dealing with COVID and SARS-CoV-2. This is a problem fed upon us, or met upon us rather, due to the fact that as we age, part of our immune system starts to diminish and we can't keep up, or parts can't keep up. So we know that. We also know that those that are not aged are struggling. So people with diabetes who have uncontrolled arterial disease and therefore heart disease, who are have poorly controlled lung conditions, who have clotting issues, who have weakened immune systems, whether that's from the use of drugs such as steroids and other immunosuppressives, which they're using for the illnesses that they have. And we have to look at whether or not these conditions are in part created by our lifestyle and by our poor nutrition. And
Mm.
going back to the soil, however well we eat, if we're not
Yeah.
getting the nutrition in what we think is healthy, and then we
Mm.
are forced by financial necessity to eat food that is cheap and not very nutritious, we are moving ourselves into a very difficult arena. We can compensate for that by taking nutrients, by understanding dietetics, and by reducing some of the risk factors. Smoking is a huge one. The rate of lung
Mhm.
disease and cancer is dropping, and in the 10 years since smoking has become more restricted, we've had a good 10% at least reduction in a lot of our illnesses that are directly associated with our
Mhm.
bad habits. But we also get influenced by not exercising enough, or interestingly, exercising too much. We get
Sure.
downtrodden by carrying more weight than we should. We get downtrodden by so many different things that we do. A lack of sleep,
Mhm.
sleeping in areas that are too bright, too noisy. So if we look at this and recognize that the viruses that we're having difficulty in beating are hitting those of us that are unhealthy, not necessarily and not always through their own fault. I don't want to suggest that this is picking out particular groups of people who deserve it. Far from it. This is a disease that is quite capable of hitting those of us who do our very best in all forms of self-well-being. But we need to do better. We need to understand about our bodies more. And
Indeed.
again, I talk a lot about looking at ourselves, but also establishing where our problems lie. We have a huge number of people in hospital beds who are with COVID, about 80%, who are found to be vitamin D deficient. And although functional practitioners and integrated doctors have been yelling this from the rooftops from the get-go, and it was then in February and March last year, an estimation. We're now finally getting the studies that support it. And if you are vitamin D deficient, we're going to run into trouble, more so than if we're not. Now, we can test ourselves for vitamin D. We can actually take a little bit of vitamin D every day, stop ourselves becoming deficient. If we had started that a year ago.
How much do we need of vitamin D?
Well, that's a very difficult one for me to answer to a broad public. I can only answer it directly to my patients. What I'm going to say is that the Scottish government are distributing 400 international units to their population. Many people don't think that's enough. 800 international units has been touted as a general acceptable dosage. No, most of us in functional medicine don't think that's enough. The authorities who actually study and write about this and do papers on it are suggesting that 4,000 international units at this time of crisis would be advantageous. But the real issue is that taking vitamin D at the time of getting COVID infection isn't as good, because it takes about a week or so to be converted in the body. Even the stuff that we buy that is arguably active, the vitamin D3, has to be converted into the active form in the human. Takes a few days to do so. So in hospitals, we can administer it, although I don't think we do in this country to the same degree that they're doing in America. So it's about continuity. I can't give an absolute dosage, but I've bandied around some figures that you, as an individual, you and your doctor and you and your nutritionist would need to isolate and choose for you as an individual. Too much vitamin D is dangerous too. Certain conditions shouldn't have high vitamin D as well. So if you've got any doubts at all, you should discuss this with your primary care practitioner.
Okay, great. All right, I'm going to shift gears a little bit here. So I'm part of a group, a Facebook group that has fibromyalgia. And we're always looking for solutions, really. So I just want to pose a question to you. What do you see is the sort of root cause of things like CFS, ME, fibromyalgia, those types of things, and what can we sort of do about it?
Okay, well, I'm going to start by putting my conventional medical hat on over the hair that hasn't been cut now for several months. And I'm going to say that the conventional attitude is that we have got marked levels of understudy, poor research into the underlying reasons of why chronic fatigue is present. We're even only really coming out of the dark ages of accepting that it's a condition at all. So the elder GP would have had no formal training, and the younger GP and medical school students are still struggling to get any sort of hard science behind the underlying reasoning. Interesting, again, the COVID issue and the development of long COVID is pushing us into finding out more about it. And the studies that come forward are going to be invaluable with regards to chronic fatigue, fibromyalgia, excuse me. So, in effect, the underlying cause from a conventional point of view is poorly understood. Dr. Sarah Myhill and her scientific colleagues in 2009 put forward 3 papers between 2009 and 2012, pointing out that mitochondrial dysfunction is a primary association with about 95% of people with chronic fatigue and therefore ME and fibromyalgia. Mitochondria are very small parts of cells that take a small amount of oxygen, a molecule of oxygen, a molecule of sugar, combine it and turn it into energy within the cell. If you block mitochondria, then you start to end up with problems. You can't actually generate the energy for the cell, and depending on which cell is affected, that organ will stop functioning to its optimum. If it's the liver cells, kidney cells, you may not detoxify so well. You get a build-up of toxicity. But heart cells have around 4,000 or 5,000 mitochondria in them, and that's if you're not athletic. An athlete's heart may have 10,000 mitochondria per cell. The nervous system can have up to 2 million mitochondria in the longer nerves, the ones that might be traveling down your leg, for example. Whereas the smaller neurons, perhaps the ones in the brain, will have 4,000 to 6,000 mitochondria per cell. Now, if you get a 50% blockage or obstruction of use of a mitochondria in a cell that needs 5,000, it's different from a cell that needs, say, 800. An 800 cell going down to 400 might manage, but a bigger cell, like the heart cells or the nervous system cells, may well not be able to function. So we've got the mitochondrial aspect, and there are treatment courses for that. Now, because of COVID, and we're looking at long COVID, and this is really early days, of course, they're beginning to see a similarity with a condition called mast activation syndrome. And mast cells are...
Can you explain that a bit more?
Yes, mast cells are the cells that are found within the body tissues as well as the blood cells, and they're responsible for the production of cytokines, interleukins, and particularly histamine. And I'm really cutting this down. There are a lot of cells involved in this.
Sure.
And these are the chemicals that tell the blood vessels to open up. And the blood vessels, when they open up, allow more white blood cells in. These chemicals also activate the white blood cells that then attack whatever the mast cell has recognized as an enemy. Now, mast cells can get it wrong in so much as people with hay fever struggle with histamine release, which is why antihistamines work. And these histamines cause the cells, the blood vessels to swell. The tissues get flooded. We get blocked. We produce more mucus because there's more activity there. So the mucus-producing cells produce more mucus. So we get the runny nose, the runny eyes, the blocked nose. And this is all down to a mast cell response. But when the mast cells become overactive, you then end up having a problem. And there are medications that can be used. Antihistamines are a simple one. There are more dedicated ones, which are H2 histamine receptor blockers. These two act like antihistamines and can reduce the effects. Now, what it appears is that people have been trying, doctors have been trying these in long-term COVID and started to see benefits. They're cutting down the length of time that people have their persistent COVID-like symptoms or their post-viral symptoms from SARS-CoV-2. So we're going to watch with great interest whether or not that becomes a pathway we can travel down. With regards to...
Sorry, I just wanted to go back slightly to what we were talking about more with the pain management with CFS and ME and so on, fibromyalgia. I have found that reducing my oxidative stress has really helped me to take down the inflammation. And helped to relieve the pain that I've been having. So much so that I'm able to function, I'm able to move, because before I was struggling to get out of bed, had a lot of pain. So any thoughts on that with regard to reducing your oxidative stress?
Of course, oxidative stress is a technical term, and really it boils down to free radicals. Free radicals are charged particles that can cause damage. If you've got a positive or negative charge, it will attract a positive or negative ion. And your cell's structure have negative and positive charges. And if you've got a free radical there, it will pull that charge away. That charge leaving that cell or the molecule within the cell causes that cell to start to break down. And you have problems with cell membranes and other energy issues with the function of the cell. So these free radicals creating oxidative stress are often counteracted, as you know, by antioxidants. And antioxidants come in many different guises. The ones that are most effective and best known are things like vitamin C, vitamin E, vitamin D is a very potent part of anti-oxidative stress processes. You have flavonoids found in most fruits and most vegetables. Then you've got specific treatments, green tea, ginkgo, CoQ10, ginseng. These all have antioxidant effects. The ones I've mentioned specifically because they also have an effect on interferon. Now, interferon is a chemical produced by the human body, by the human cells, and works in what is called the innate immune system. The innate immune system is the first part of your defense system. So it is useful to use all of these, not only in oxidative stress, but also to encourage the right production of interferon. Now, interferon governs your inflammatory response along with many other things. So these plants and natural extracts and vitamins and minerals are all well scientifically proven to benefit us. And if we use those alongside things like essential fatty acids, which are in themselves very useful in quelling the fire that we have, and add them into those that I've mentioned, quercetin, bromelain, the list is so long. So healthy dieting, natural juicing, juicing of natural vegetables and fruits. Put these into your dietetics, and you're halfway there to reducing oxidative stress. And it's a very big part of pain reduction, as you said. It's important to try and remove other causes of pain and never forget structural aspects to pain. If you start to get a pain in a fibromyalgia area and you tense up, you're going to pull your head over to compensate. You're going to tip your body over to keep your head right. You're then going to put pressure on your spine, pressure on your pelvis. Restructuring is a huge benefit, and it's worth having a look at something called the Perrin technique. And the Perrin technique is a physiological, structural, therapeutic technique that has got decades of proven benefit in people with chronic fatigue, ME, and fibromyalgia. It's well reported. It's hardly ever used. I very rarely see a patient with any of these conditions who doesn't end up at some point seeing whether they get benefit from a structural therapist.
Okay, I had a question as well. Somebody put a question across, and that is whether fibromyalgia and those types of conditions are more affected by emotions, or emotions affect fibromyalgia, or if it's more of a physical thing. Can you address that
yes,
question?
Of course. There is very little that goes on in the body that doesn't get made better or worse by your neurohormones, your neurotransmitters. People can be in terrible pain and feel very little because of the high amount of adrenaline. Conversely, a level of adrenaline can make a pain or a discomfort far worse. It can magnify it. Sure. The immune system is upregulated by adrenaline. The immune system is interfered with in that way. So you've got the inflammatory response is a big part of the immune system. So again, if you are adrenalized, if you are anxious, if you're worried, you've got every reason to expect things to worsen. Conversely, the calming parasympathetic hormones, the things that calm down the body, the vagal nerve activity that stimulates all sorts of calming hormones, does exactly the opposite. It calms things down. It stops things from being overactivated. There's an extract from palm oil and egg yolk called palmitidoyl ethanolamide, or abbreviated to PEA, that is being used in chronic neurological pain and is now being trialed in chronic fatigue. Things like phospholipids, phosphatidylcholine can be used to, again, influence how nerves control pain. We've got CBD oils. And one of my preferred and favorite, albeit prescription medication, is low-dose naltrexone. I think this is highly underestimated as a methodology of affecting the neurotransmitters. Now, you can go online and tap in yoga, you can tap in meditation, and any other branch of mind calming process or practice, and put in a disease after it, whether it's asthma or depression, whether it's irritable bowel syndrome or inflammatory bowel disease, and you will find papers that show how, if you keep calmer, if you can do things that help relax you, you will have a direct biochemical response on these problems.
Yes, a couple of questions now. I just want to ask you, you mentioned about research. So two sort of questions, if I may throw them in. One, do you look at pubmed.gov as a place to research and look for peer reviews? That's one question, because I've discovered it recently and it seems to be a good resource. And I want to know if the medical profession goes there. And also, I've also found out that the University of Washington has stated that the study of NRF2 is going to be the most significant thing affecting our health and that we need to find out more about. What are your thoughts on those two, please?
PubMed.com, not .gov, is known by every student in medicine from year one upwards. It is the library of research. And anything that is published in a recognized journal, and often things that are found in, shall we say, lesser journals that may not necessarily have peer-reviewed reports, will also often be found on PubMed. But it is very governed by the conventional attitude, and we must remember that naturopathic approaches, that's anything at all that uses a natural approach, is often not researched. And it's so important to understand that an absence of evidence is not evidence of inefficiency. It is simply evidence of a lack of funds and no commercial gain. So PubMed is a really good place to look. It will have an awful lot of information on. I don't think anything I've said today concerning any of the natural compounds I've mentioned, you wouldn't find PubMed papers on it. You may have to search though, because there may be several thousand drugs researched, and then you've got 10 others, and you have to pick them out. But if you type in the right things, you'll find it.
Sure.
So that's a good one. Google Scholar happens to have quite a lot of information on it as well. Another good resource. With regards to NRF2, I'm afraid you've caught me on the hop there. I haven't researched that. I'm not going to be able to answer it at the level that I should be able to. So I think I'd rather skip it. But like you, I'm seeing it around, and its importance is keen.
Well, Dr. Sharma, I want to thank you very much for your time today. Would you believe that has gone really quickly? But we got through, I think, most of the questions. And hopefully I'll be able to have you back again to perhaps delve into a little bit more about some of the questions that have been raised and asked, and some of the things you talked about today. So I want to thank you very much for your time today.
It's very kind of you, and thank you very much for having me on.
You're more than welcome.
Take care.
So that was Dr. Sharma, and we're very pleased and excited for him to join us today. I hope you got some value out of that. I think we've learned quite a bit from that. But I also want to say that we're doing an event on Saturday at 7 p.m. And you can email me on strictlyhealthyuk@gmail.com. And that way you can find out a little bit more about what was discussed here today. We'll delve into a bit more about oxidative stress, inflammation, and a little bit more on this NRF2 studies as well we'll be talking about. So I thank you for joining us today, and same time, same space next week, 4 p.m. We will be discussing with Mitali, and I'm trying to get her surname. She deals with how to write a book and how to get published. So hopefully you'll be able to join us and enjoy that with us next time, 4 p.m. GMT. So thank you for joining us today, and we will see you next time.